Hi, I really hope you enjoy this educational video. My name is Mark Byelich. I'm a certified financial planner, and my team and I focus on developing tax efficient or tax free retirement strategies for our clients. We also focus on investment strategies that allow folks to eliminate the worry and have the potential growth that you need in retirement. So enjoy the video, and at the end, I'll tell you how you can schedule a no cost, no obligation consultation with me. Enjoy. Hey everyone, I'm seeing folks log on. It is Wednesday, March 10th at just about 6:30. And this is one of our special webinars. And I have Steve Bobrin, the Medicare expert, with us. Steve just waved hello if you didn't see him. And we're going to spend the next hour or so talking about everything Medicare. Steve and I we've known each other for a long time, and we logged on at 6 o'clock just to make sure all the technology was working. And suddenly it became almost 6:30. And I said, hey, we've got to get on. But I hope everybody's doing well. And if you can hear us and see us okay, just do me a favor and hit that raise hand button on the bottom of the screen and let me know you can see us. Excellent. Thank you very much. So as you're logging on, I just want to remind everybody, I'm going to move my notes down here so it doesn't look like I'm looking in New Jersey, that you're going to be muted during this webinar. But there is Q&A at the bottom of the screen. So you see that you've got a toolbar. You should have a toolbar at the bottom of your window, your Zoom window, and you can click in there and ask questions. Type in your question. Don't be shy about asking questions as we go. Steve loves answering questions.
I do.
He does. And so we can, if it gets answered, it's okay. We'll say it's answered, or just write a note to us. Hey, I got my question answered. But don't be shy. Fill it out, and we'll stop periodically and go through it. Chat, however, is disabled. So that is a crazy regulatory thing. They require us to disable chat. I couldn't really tell you why, but I just follow the rules. And as I said, this webinar is recorded. Steve and I were both talking about Ed Slott. Steve met Ed Slott a couple years ago, and he's got a signed book from him. And I was telling him about that. We just had the book launch for Ed last Tuesday. So that was a lot of fun. I hope many of you had a chance to join us on that virtual book launch. And if you need any more information about Ed Slott, reach out to me. At the end of this webinar, as with all the webinars, my calendar is going to populate on your screen, and that gives you the opportunity to book time with me if you have a question regarding something we talked about tonight, or anything pertaining to your financial planning, or anything we've talked about before. So with that, Steve, let me introduce officially Steve Bobrin. So Steve's a good friend and colleague of mine. Steve owns a company named Del Val Seniors. What town is that actually considered to be?
It's in the town of North Wales.
So he's got a beautiful office in the town of North Wales. Are you in your office often now, Steve?
Every day.
Okay,
actually.
Good for you. So Steve's acting normally. I'm still working from home, so good for you.
I'm the only one there.
Yeah, well, that's okay. But even though Steve's in North Wales, he helps Medicare folks, or helps people with Medicare in 14 states, and he has over 2,000 Medicare clients. That's really impressive. Steve holds education events in more than 30 municipalities in Pennsylvania. That's very impressive. I actually did the first one with Steve that he did probably about, I don't know, could that have been 10 years ago?
Might have been. It didn't go well from my perspective, I didn't think, but I learned a lot.
It was fun. It was a whole group of individuals that we were involved with, and we all kind of had a piece of it. And it was a learning experience.
It was.
But most importantly, Steve is my go-to expert, bar none, for everything Medicare. So he adds so much value to my practice because there's so many things as a certified financial planner that we have to know. Steve takes Medicare off the plate for me because I know that I can call him at any time, text him even on the weekend, and he knows the answer, and I can 100% count on that. And he's got a 100% success rate, because I've referred a lot of my clients to Steve, and everyone has come back and said, I really appreciate it. The guy knows what he's doing, and it was really, really helpful. So that's about the best intro that I can give anybody, I think.
Well, thank you.
Sure.
I'll take it.
We have a couple questions already that came in
Wow.
before the class or the webinar that we're going to get to, but we're going to have a poll. So should we kick off with the first poll, Steve, or would you like?
Sure, we could do that.
All right, let's pull that up. So I'm going to put this poll out, and this first poll is, what year did Medicare start? And this is a multiple choice. So we have 1980, 1965, or 1945. Now, don't say anything yet, Steve. We're going to let people weigh in, and then Steve will give us the answer. So 1965 is a strong lead right now.
So since I can't vote, what do I do with the pop-up on my window? Close it?
Why can't you vote?
It says host and panelists cannot vote.
Oh, okay. Well, then you can't vote. I don't know. I'm sitting here. I'll hit end polling at some point, and then
I just took it off my screen, so
Hey.
I wasn't sure what to, I was afraid at first, but I got over my fear.
Okay, I think we've got I'm going to end it in just, we'll give it about 7 more seconds here. We've got a clock up here. All right, there is no prize for this other than being able to gloat. So most people chose 1965. About 23% of you chose 1945, and 3% of you chose 1980. So Steve, what's the actual answer?
The actual answer is 1965.
Nice job.
I don't want to give away, there's more, a little bit more to it and all of that, because there's some other questions that become part of that. So we can talk about it a little bit later, how it came to be. But 1965 is the correct answer.
Okay. So we have, let's start with these 2 questions, and then we'll move on and let you start your presentation. Is that okay?
Sure.
Jeff asks, and Steve, I don't know if you can see these questions or not, but Jeff asks, does Steve help people in Virginia?
I believe that we are appointed in Virginia also. So the answer is yes.
And then Roseanne's asking me, my question regards too much to type. Can I ask orally? Well, I don't know. I've never done that before. Let's see if I can give somebody the opportunity to say something. This might be really interesting, Roseanne. Okay. You know what? I've never done this. I'm going to try to allow you to talk, Roseanne, if you're okay with that. So let's give this a shot. So Roseanne.
Oh, here she comes. I know Roseanne Harvey.
Yeah, that's the danger, is that now her last name's out there. Roseanne, though, to talk, you have to unmute yourself. There you go.
I did.
Hey, Roseanne.
Hi, Roseanne. How are you?
Good. Can you guys hear me?
Yes.
Oh, well, that's a first for you, Mark, huh?
It is a first. I feel like we're on a call-in radio show right now.
Right.
Yeah. Okay, here's my question. This is all about Medicare tonight, right?
Yes.
Correct.
Okay. Steve, yes, you do know me. You were recommended by Mark
Right.
when I
Uh-oh.
first
Wait, I heard you as well. Go ahead.
So, yes, so you got us on our feet. You got us started when we retired. So we were on Aetna supplemental, and we had a Silver Scripts prescription plan.
Mhm.
So that was 5 years ago, 6 years ago. Now I decided to explore a little bit. So this year I have Blue Cross 65 plus PPO.
Mhm.
Okay.
I think your question is, you're asking me, why do I buy a supplement over an Advantage plan?
You have no idea what my question is.
I guess I don't. All right.
Well, let me say this, Roseanne. So one of the things that I want to appreciate everybody else's time and appreciate your question. But if this is going to be very specific to your needs specifically, maybe it's something you might want to schedule time with Steve. I'm sure Steve will.
You can certainly call me and we can talk about it.
Yeah.
Listen, the answer is no. It's not just specifically
Okay,
to
go
my
ahead.
needs.
Shoot, you go. I'm going to put you on the clock though, Roseanne.
Yeah, you will do that, Mark. Okay, so I'm on 65 PPO plus now. I am saving $3,000 a year by being on this. Okay.
Uh-huh.
Now that has now become my primary.
It's your only.
Yeah. So what Where's Medicare fit in here?
They're paying most of your bill.
How? From where?
Okay, what happens is, well, I'll tell you what, if that's your question, I'm going to address that in what I go over.
Okay, so nobody's going to ask you this, so I am. There
Okay,
is, you know, when we get our social security check, there is $144 that comes out and goes to Medicare,
148.50 this year.
140, whatever. And that goes to, that's for Medicare. So if that's for Medicare and I'm not being covered by Medicare anymore, I got a Prime Blue Cross, where's that money going?
I'll tell you what, all what you just asked me, I am going to address in what I'm going to tell everyone, and I promise you'll understand it.
Okay, well, and I understand that, and I just want to ask one more thing real quick. Who is paying the premium to my Blue Cross? I have no
Well,
premium or anything.
Yeah, the government is. I'm going to go over that.
Okay, goodbye.
right.
I'm going to wait for
Okay.
you.
Okay, these are great questions, Roseanne. Thank you. Good
Fun.
hearing from you.
Nice to talk to you, Roseanne. All right.
Now, is Roseanne going to stay there the entire time?
I don't know. This is I've never done it quite this way before.
Okay, I don't want to remove Roseanne from the meeting.
I
Okay,
don't think it,
why don't you start and I'll figure this out while you're presenting.
okay. So, hi, everyone. Again, as Mark said, this is Steve Bobrin. I'm going to share my screen with you. So Roseanne and myself, everybody's going to get smaller. Hopefully everybody can see this. It's as large as I can make it on my screen, and it should be nice and large on everyone else's screen. So, by the way, like most of you or many of you, I am also a client of Mark's. He's my financial planner also. So I just wanted you to know that.
Well, thank
All
you.
right. What's that, Mark?
I said thank you.
You're welcome. So let's talk a little bit about, and Roseanne, I promise I'm going to address everything that you said or asked me. Before we get into the plans and how they differ and all that stuff, let's talk a little bit first about, number one, when do you need to sign up for Medicare? Because that's the first thing. So it depends on your situation. So if you are an individual and you have individual health insurance, not group insurance, when you turn 65, you need to have Medicare because Medicare is primary and that individual plan does not want you any longer at that point. Number one. Number two, if you're working and you work for a business that employs less than 20 employees, even though you're working full time and you have a group insurance plan, because it's less than 20 employees, you need to have Medicare A and B. Why? The insurance company, whether it's Blue Cross or Aetna, whatever it is, whoever they are, that group insurance carrier is going to require it. Your group plan in that situation is going to be a very expensive Medicare supplement. Okay, so again, if you're working, but the business is under 20 employees, you still need to sign up for Medicare A and B. If you're working full time and you work for a business that employs 20 or more, then Medicare is secondary. You are not required to sign up for Medicare and will not be penalized later if you do, if and when you do. So that's who and when, or who needs to sign up for Medicare. Now, when do you do it? And if you look at this chart, you'll see that this first part here refers to someone who's turning 65. So in this example, this person is turning 65 in June. It doesn't matter what day.
Steve, I'm sorry. Is there any way you can make that chart a little bit bigger? Do you know?
I don't think I can.
Okay, that's fine.
All right. It's just
Fine.
okay. I don't know any way that I can just no.
No, it's okay.
I don't know another way. I don't know how to make it any larger than it is.
No, that's fine. Thank you.
Okay. So going back to Medicare always starts on the first of the month. If you're born, it doesn't matter whether you're born June 8th, June 10th, June 25th, Medicare is still going to start June 1st. If you happen to be born on the first of the month, Medicare will start the first of the previous month. That's how it works. In this scenario, this person needs it June 1. And if you're signing up, you have the 3 months before you turn 65, the month you turn 65, and the 3 months after. If you wanted to start June 1, you must sign up March, April, or May. You'll get the June 1st effective date. If you wait till the month that you sign up, which is June, you're not going to get it till July. And if you wait till a month later, like July, you're not going to get it till September. They skip August. And if you wait till August, they're going to skip October. You're not going to get it till November. And you can see if you sign up in September, you're going to get it in December. This is etched in stone. There is no deviation. So if you need to know what month you need to start it, and follow this chart. And by the way, I will at the end give you my email address. If anybody wants these slides, just email me and I'll send you a copy of it. Now, once you turn 65 and 4 months or older, this all changes. You can sign up any month you want at that point. When you're signing up during your initial enrollment period, which is this part up here, you're going to sign up online, A and B. When you're signing up and you're 65 and 4 months or older, it's a little more protracted on what you need to do here. You have to sign up for A, which you can do online. Then after you sign up for A and get your Medicare number, then you have to sign up for B. Normally, you have to have a form, and we have the form. It's called a request for employment form, signed by your employer, given back to you, and you take that along with your Part B application to a Social Security office. You can't do that right now. And during the pandemic, there is a way to sign up for B online also. But again, you still have to sign for A and get your Medicare number before you can do that. So we say that if you're 65 and 4 months, you want to start that process of signing up for Medicare at least 60 days prior to the date that you need it. Okay? All right. This link, and again, if I email it to you, it will be a live link because they're PDFs. This is where you're going to sign up for Medicare A or Medicare A and B. And by the way, even if you're working for a business with over 20 employees, as long as you're not in a high deductible health plan and contributing to a health savings account, there is no reason to not sign up for A. It's no cost. It'll make your life easier because you'll have a Medicare number at that point, and it'll make it easier to sign up for B later. If you're contributing to a health savings account, you cannot sign up for A because that will preclude you from being able to make contributions to that HSA. It's considered other health insurance. Okay? And again, this is the link to do that. All right. Now, let's talk about the big picture here, how all this works. When you go on the Medicare site, you're signing up for Medicare A and Medicare B in most cases. A is free and covers you as an inpatient in a hospital. It's that simple. B is not free. There's a base price of $148.50. Everyone is going to pay that no matter what Medicare insurance plan you have in addition to that. And Roseanne, I promise I will get to your question about this. But everyone's going to pay at least $148.50. If you're married and your income is over $176,000, you're going to pay more. Depending on how much over it is, there's a chart that Medicare uses, and you pay what's known as income-related monthly adjustments. That's basically a tax that Medicare charges if you earn more money. If you're single, and don't quote me, I think it's $88,000 and above, you start to pay extra as well. Okay, everyone needs, if you're going to decide to go on Medicare, everyone needs to sign for Medicare A and B. So again, A covers you as an inpatient, or B covers all outpatient expense. So lab, x-ray, physical therapy, doctor visits, outpatient surgery, just to name a few things. Again, A is inpatient, B is outpatient. Now, there are two different ways to buy Medicare insurance plans. Some people elect Medicare Advantage plans. Others elect Medicare supplements. So we're going to talk about each so you have a better idea of how these work. Medicare Advantage plans are called Part C to the government. To you, they are a private insurance company that is replacing Medicare for everything. So if you had something like what Roseanne was talking about, which was Personal Choice 65 Prime, Blue Cross, which is who owns personal choice, is replacing Medicare. You cannot show your Medicare card to any provider, hospital, doctor, or otherwise. That's not what you're doing. Medicare is not going to pay your claims. So you're still going to pay for Medicare B, and I'll explain why in a minute, but that card is going to be dormant. That coverage is going to be dormant. You cannot use it. Here's what happens. If you sign up for a Medicare Advantage plan, you are telling the government, we're not going to use you. You're not using their network. You're not using their benefits. What the government is doing is they are going to send, in this area, approximately $900 a month per person to subsidize the cost of this plan for you. So every month they're sending $900. Answer Roseanne's, one of her questions was, why do I have to continue to pay the $148.50? Well, the reason is the government's sending $900, they're getting a little bit of that money back. They're not going to let you off the hook. So even though you can't use Medicare A and B, you're still going to pay the $148.50 because they in turn are paying more than you're paying. That's why you have to pay it. Okay? Now, these Medicare Advantage plans will come with their own Part D. Part D is a drug card. Think of D in drugs. It'll come with its own Part D prescription card. You have no choice. It's just whatever it comes with. However they pay your drugs, that's how it works. Sometimes they offer an option to not have the drug card. And you can have a plan. There are plans without drug cards. But in that case, you can't go get it somewhere else. It means you have no drug coverage. And we'll talk about the ramifications of that in a little while. Some of these plans offer some dental, vision, or hearing. Sometimes it's an additional cost. Sometimes it's included. It just depends on the company. Okay. But again, you're not on Medicare at this point. You have a private insurer that is replacing Medicare. Medicare is not primary. They're not secondary. They're not in the picture at this point. Okay. The other way to do this is to use original Medicare A and B as your primary source of insurance. Then you would buy what's known as a Medicare supplement. They sometimes call this a Medigap plan. There are two ways to say the same thing. What this supplement does is it fills in what Medicare A and B doesn't cover. To what degree just depends on which plan you pick, and we will look at those. No supplements offer prescription coverage, so you are buying a separate Part D drug card, and you're buying one based on the drugs you're taking at that time. We'll get into Part Ds. You will be allowed to change your drug card each and every year as you see fit, and we'll talk about that in more detail. Some Medicare supplement plans offer some discount vision and discount hearing. They do that because they're trying to provide some level of benefit for things that Medicare does not cover. Okay, Mark, any questions?
We have one from Eric. Eric asked, is the earnings threshold for Part B rates earned income only or all income, including investment income? So it's referring to the income-related monthly adjustment amount.
Right. So it's based on your adjusted gross income, whatever that number is. And by the way, it's when you go on Medicare, they're looking at your income each year, but with a 2-year delay. So if you were going on to Medicare in 2021, it would be first looking at your 2019 return.
Yeah, so let me comment on that. It's based on your modified adjusted gross income. So with a lot of my clients, what we're doing is Roth conversions, as you know, Steve. So that adds to that modified adjusted gross income for the instances of IRMA. So you have to be aware of that because that's one of the costs of doing a Roth conversion, and something that people that aren't seasoned in this and haven't worked with these tax efficient strategies, they'll miss that. And suddenly, so the additional surcharges can be as high as $433.50, which is a lot. That's monthly per person.
Right.
So if you want it, I had talked about this before. I've got a really great chart from Ed Slott that the Ed Slott group that has, it's titled 2021 Medicare Income Planning. It shows all the charts for, or all the surcharges for single and married filing jointly. And it also has some idea of income reduction strategies. So if you'd like that, send me an email, either just reply to the email that you received for this webinar, and I'll be happily send it to you.
Okay, great.
Roseanne is asking, if you have an Advantage plan, does your prescription come from the same company as the medical plan?
Yes, it does. So if you have a Medicare Advantage plan, you have to take the prescription card that comes with that plan. There may be a mail order piece to it, but it's going to be the same company. There's no option that way. Okay.
Yep.
All right. So that's the big picture. Now, everything, and you can see that we have a lot of color and a lot of circles here with different letters. So everything that we're going to look at after this refers back to this chart. So I just wanted you to understand that. Okay. Let's talk a little bit more about Medicare Advantage plans. Medicare Advantage plans are federally regulated. So why is that important? Why do you need to know that? The open enrollment period, which is October 15th through December 7th each and every year, is an opportunity to switch from a Medicare supplement to an Advantage plan or from one Advantage plan to another. Okay? The open enrollment period is a federal program, and only the products that are federally regulated are part of that. This is one of them. Not all the Medicare products or plans that you buy are federally regulated. So it's not like you can just switch back and forth as you see fit. And you'll understand that a little bit better as we get more into this. But Medicare Advantage plans are federally regulated. There are never any health questions. So you can always switch to one of these. If it's an HMO style plan, it may require referrals. If it's a PPO style plan, it will not. And there are some HMOs that don't, some do, some don't, just depends on the company. The PPO style plan does not require referrals. With these types of plans, there are deductibles, copays, and coinsurance. These plans can, you can spend as much out of your pocket as $7,550 a year in out-of-pocket costs. That is for inpatient and outpatient care. So going back to the question that Roseanne asked me, why would anybody not buy this? It's because the out-of-pocket cost, if you're using it, is considerably higher than it would be using original Medicare and a supplement. That's one reason. Secondly is, with these types of plans, since the insurance company has taken over for Medicare, they're in charge. They get to decide, well, you know what, we don't necessarily want you to go to this facility. We would prefer you go to this other facility first, or we want you to have this test first. So they can decide that like they can with regular health care, because Medicare is not dictating to them what facility you can go to. They get to choose that themselves. So there's more of that goes on. If it's an HMO style plan, you're going to have to go to your primary. Even the ones that don't require referrals, you can't go wherever you want. You can go to a specialist within the network, but you still are capitated when it comes to lab work and other imaging and things like that. In the PPO, you can go anywhere in the network. Again, the $7,550 is excluding whatever you're spending for drugs. So depending on your health, this can be more expensive. And secondly is networks can be an issue. If it's an HMO style plan, the network is the 5-county area. That's what your network is. If it's a PPO style plan, it depends on what company you choose on what the network is. Some companies are larger than others. When you're in another state, it depends on what plan you have, what state you're in, and sometimes what part of the state you're in whether there's in-network coverage or not. With these PPO plans, you can also have a separate out-of-pocket maximum, if you're out of network, of $11,300, which is not a little bit of money. These plans will come in generally what I call 3 premium buckets. There's the $0 to $20 plan. That's the one that's most heavily advertised. There are plans that are $25 to $75. And there may be plans that are $100 to $200 or more. In general, this is not always, but in general, as you spend more money, you get a better plan. And what you're doing is you're paying money on top of the money that the government is giving these plans. The way that they can provide a 0 premium plan to you is because the government is subsidizing the cost. This is somewhat of a political football that can change depending on what administration is in charge, because they get to decide to some degree how much money is being sent over to these private insurers to subsidize the cost. Okay, any questions on this?
Okay, sorry about that. It took me a minute to find the mute button. I've muted the my microphone because, as I told you, Steve, and I'm just going to remind everybody, I'm working from my home office, and I have a great big German Shepherd who often will just explode in barking, and I don't want to interrupt you, Steve. So yeah, we have a handful of questions here.
Good. Shoot.
So Steve asks, are the IRMA thresholds adjusted up each year? Was it indexed too? So go ahead, Steve. Do you want to take that?
So the IRMA adjustments are changed. I don't know about every year, but at least every couple of years they are. I don't know what they use. I just look for the tables each year because it's included in our presentation when we do a one-on-one. But they are adjusted most years.
Yeah, they were frozen until I think it was 20. It was a few times. It was just a couple of years ago. It was that they started really increasing. Yeah. That's a good point. I was doing a little bit of searching, just Google searching, to see if I could capture what the index is. The information I have, it just reads that, let's see, the income related monthly adjustment amount, which again is the IRMA, their surcharges are adjusted for inflation each year. That could mean there's several different versions of inflation. So that's a good question, Steve, but Steve Schmidt, but Steve Bobrin is correct. You can find these tables easily on Medicare's website.
And the money is used to keep the Medicare fund alive. That's what they use it for.
Yeah.
Was there another question?
Yeah, and we know that the trust fund for Medicare is running out of money very, very soon, right?
So they say, yes.
Yeah. So 2024, I think, was the last update, which is right around the corner. So since Medicare, Roseanne, same Roseanne this time, as we had on the line, since Medicare is not covering me now, who is paying Medicare Part B annually? Does that make sense?
No, I'm not understanding. So there's the 148.50. She's still paying. That has the 148.50 per month. You're either paying it out of your pocket or it's coming out of your Social Security check if you're collecting.
Yeah. Let's just see if there's additional clarity on that. So Roseanne, if you want to type in anything additionally, that'd be great. Michael, hey Michael. Michael asks, are you allowed to change your Medicare plan you choose before next enrollment period commences? So within the plan year, are you allowed to change your plan?
So this depends. With Medicare Advantage plans, the answer is no. With Part D prescription cards, the answer is no. It can only be done during open enrollment. The next slide that I have talks about supplements. That they work differently. You can change those from year to year with some caveats, which we'll get into.
Great. Gene asked, for a PPO plan, must you choose a primary physician in a network?
You don't have to choose a primary, but if you want to pay the smallest amount of money when you go to see one, it has to be somebody in network. If you choose somebody out of network, there's going to be deductible and co-insurance.
Okay. And then a different Roseanne asks, an HMO and PPO have networks. Does Medicare have networks?
Medicare does have a network, but the difference is that Medicare is the largest network in this country. It's bigger than any insurance company network. It's a national network, extremely robust. And I'll get into that a little bit more when I go to the next slide, and you'll understand a little bit better.
Okay, we have one more question I'm going to take before we move on. Margaret asks, I am
I know her too.
Which I'm assuming, can you see the name?
I can't, but I know who you're talking about.
Okay. I am F, which I'm assuming is female. I am F and want to know if.
No, she has Plan F.
Oh, Plan F. Okay, thank you. I am F, Plan F, and want to know if it is better to stick with it than switch to G or N when we get to that.
So that's on the very next slide. I'll address that.
You know Margaret, and Margaret teed that up for you.
I did. I know who that is also.
Okay.
All right. So I'm going to switch to the next slide.
Sounds good.
All right. So we just talked about Medicare Advantage plans. I told you they were federally regulated. You can switch anytime, no health questions. But there's a fair amount of out-of-pocket costs if you're using them. Medicare supplements are different in many ways. Number one, the annual open enrollment period, which is October 15th through December 7th, as we just discussed, does not apply to Medicare supplements. Some people are shocked and surprised to hear that. Medicare supplements are state regulated. So it's different. This annual open enrollment, again, is a federal program, and only the products that are federally regulated are part of that. Because this is state regulated, they don't fall under that purview. And so this annual open enrollment, if you'll notice, when you watch the commercials, they're very vague. They don't say what you can or can't do. It pertains to two things: Medicare Advantage plans, Part D prescription cards. Medicare supplements are not part of that. When you're turning 65 or getting Medicare Part B for the first time, you can buy a Medicare supplement with no health questions, no pre-existing conditions. You are allowed to change your Medicare supplement any time of year. However, once you've had Part B for more than 6 months and want to change, you can, but you will then be asked health questions, whether it's the same insurance company you currently have or a different one. Then the insurance company has a right to accept you or not. So for example, I had a client that came to me and said, hey, my rate went up. Can we do any better? I said, well, this one company potentially could be better depending on how they underwrite you. Well, they went through underwriting and it was considerably more expensive. We just found that out today, so they're keeping what they have. So yes, you can change. It depends on your health, on whether it's going to be easy or hard. So these are much harder to get later, number one. And the second thing you're going to see is there's much less out of pocket. So Medicare supplements, while state regulated, the federal government designs them. So they're standardized. It does not matter what Medicare supplement what insurance company you buy your Medicare supplement from. If you're buying a Plan F or a Plan G or a Plan N, it's identical. You're all going to pay identically. The way it works is if Medicare says it's an approved expense, they're all going to pay. And if Medicare doesn't put their blessing on it, it doesn't matter what company you have your supplement from, they're not paying either, because they're just keying off of Medicare. When you buy a Medicare supplement, you are not buying a network like you are with an Advantage plan. When you buy a Medicare supplement, it is doing just that. It is supplementing Medicare, and Medicare is always the network. And as I said earlier, Medicare is the largest network in this country. It's a national network. So if you're traveling, some people have a house in Florida or kids in another state, or a house in another, it may not be Florida, but another state. It doesn't matter. You can see anyone, anywhere in this country, like it's your own backyard if you have this type of plan. There are no referrals. There are no pre-authorizations. There is no insurance company getting between you and your doctor. This is not managed care. Matter of fact, Mark, do you want to ask the next? There was another question. There was one about what Medicare was patterned after.
Yep.
I think now would be a good time.
Okay, so this is poll number 3 I'm going to launch. And the question is, what was Medicare patterned after? And it's multiple choice. And the first answer is the Philly special, the Philly. Remember that? The Great Britain healthcare system, the famous TGBHS, or Blue Cross Blue Shield Major Medical. Can you see the poll, Steve?
I can see the poll.
Can you see an answer too? The answers?
No, it just says at the bottom, hosts and panelists cannot vote.
I see. Okay. So we have 42 right now. We've got about 38 to 40% saying, talking about the TGBHS, the Great Britain healthcare system, and 59% Blue Cross Blue Shield Major Medical.
These questions are too easy. Can I give the answer?
Not yet.
Okay.
We're just going to give it about 40 more seconds, if that's okay.
Mm-hmm.
Actually, not 40 seconds. It was counting the other way. So yeah, we'll end the polling. So the answer is it was pretty tight. So 63% said Blue Cross Blue Shield Major Medical, 41% said the Great Britain healthcare system. So Steve,
so
go ahead.
So the answer is Blue Cross Blue Shield Major Med. So going back, if you
Wait a
recall,
minute. You can't just gloss over that. First of all,
I wasn't going to.
oh, okay. So if you remember, the Philly was really the winning. I think it was the winning. I can't remember now, but I think it was
It was a trick play.
the winning trick play when
Right.
the Phillies won the Super Bowl. So nobody chose that. So, I thought one person at least would do that. The famous Great Britain healthcare system, the TGBHS, is something we completely made up prior to this. So the only question or the only answer is the Blue Cross Blue Shield major medical. So just trying to have a little fun. So go ahead, Steve.
All right. So in 1965, Medicare was first started. And it was patterned, as most of you know, after Blue Cross Blue Shield Major Med. So when you look at Medicare Part A and Part B and a supplement, that's what we're referring to. Because Blue Cross covered the hospital, Blue Shield covered the doctors, and Major Med picked up what Cross and Shield didn't pay. Well, Medicare A covers the hospital, Medicare B covers the doctors, and the supplement picks up what Medicare A and B doesn't pay. So it's just like that. In addition, and one of the reasons, Mark, that I asked you to do it now is back in those days, there was no managed care. It was strictly, if you want to go, you can. Well, when you have Medicare A and B and a supplement, it's not managed care. There's no pre-authorizations. There's no pre-admission testing. There's no network other than Medicare. But again, that's the largest network. There's no one getting between you and your doctor. If you go to your doctor, he says you should, he or she says you should have it. And as long as it's an eligible expense with Medicare, you're going to get it. In a managed care situation, that does not always exist. So this is easier access to care, which becomes more important, especially as you get older. So that's why I wanted you to ask that question now, because I thought it all sort of tied in.
Perfect.
Okay.
You want to take a break for questions real quick?
Sure.
Okay. My screen is full of Roseannes. I have two different Roseannes, 4 different questions, two from Roseanne each. So Roseanne number 1 asks, Linda, I see your hand raised. If I can't respond to a raised hand, but just go ahead and type a question, unless there's some kind of issue. Maybe y'all aren't hearing us. When I was on a supplemental, we had to pay $198 Part B before we were covered for anything. Is the amount for Medicare on my Social Security the same as Medicare Part B?
She's referring to the Part B deductible. And I don't know that I'm understanding the question 100%. There is a deductible under Medicare Part B. It doesn't matter which plan you have, you're going to pay well, there's one exception, but other than that, you're not going to pay that deductible. The amount that you spend for Medicare is $148.50 or more, but they're 2 separate issues. The deductibles, coinsurance, and copays under the Advantage Plan are completely different from that. So I don't know if I answered the question, because I'm not exactly sure what the question was.
Well, I think so. There were 2. It was 2 different entries, but I think it was leading up to the same kind of the same question. So she said, when I was on a supplemental, we had to pay $198 Part B before we were covered for anything. So that sounds like deductible.
That was a deductible.
Is the amount for Medicare on my Social Security the same as Medicare Part B? And I think she's referring to the premium that comes out of Social Security to pay for Medicare Part B.
Yes, that doesn't change regardless of what type of Medicare plan you have. It's a separate transaction between you and Medicare.
So again, the only thing that'll change that is that income related monthly adjustment amount. And that's all based on your modified adjusted gross income.
Right.
Or how much money you earn in many different areas. The second Roseanne, I don't know if it's one question in 2 parts or 2 questions. If you start out with an Advantage plan and a few years later switch to original Medicare, can you still buy a supplement plan?
So there's 2 answers to that. One is, if you buy an Advantage plan first, you can switch within the first 12 months back to original Medicare and a supplement, no health questions. If you've had an Advantage plan for several years, there's something called, actually, I take that back. There's something, let's say you had a supplement, like in Roseanne's case, and then you switch to an Advantage plan. There is something called a trial right. And the trial right says that the government says, we'll give you 12 months to be on this Advantage plan. And if you don't like it, well, let's just switch back to the original plan that you had with the same company with no health questions. So if you've had an Advantage plan for several years, then number one, you can only get out of it during open enrollment, and you would be subject to health questions to get us, and you may or may not get the supplement depending on the severity of your health. Okay.
That's interesting. I don't think I knew that.
Okay.
Um,
I hope I brought something to the table that you
yeah,
didn't know.
no, that's good. That's really great. I didn't know, it's kind of like the Social Security do-over, right? Within that 12 months.
Yep.
I'm still wondering, so Margaret writes, I'm still wondering if Plan F, which includes all.
We just didn't get to that yet. We're leading up to that.
Margaret, we're not there yet. So I'm going to dismiss that question. And if we don't cover it, come back.
We will. It's on this page.
All right. So Jean asks, this is interesting. If someone plans to live abroad for 3 months and return to the US for 3 months, can that person use the Medicare Advantage plan benefits if they get sick abroad to pay for medical care?
So whether it's a Medicare Advantage plan or original Medicare, neither one of them cover you abroad. However, there is something in the Advantage plan and in the supplement called, and it's down here at the bottom, called foreign travel emergency. It is not designed to provide healthcare to you if you're living abroad. It's for emergency purposes. It's got a $250 deductible. It pays 80% to $50,000 lifetime. It's designed to get you well enough to bring you home. That's all there is, and it doesn't matter what plan you go with. That's how it works. Okay. Is there another question?
No, that's it for now.
Okay, good.
Steve, that's impressive. I got to tell you, I am always so impressed with the detailed knowledge you have about these Medicare plans. It's
well, you know what?
I thought that
just like you're extremely knowledgeable in what you do, we sort of have to be.
Yeah, right. Thank you.
So,
Okay.
So here's how these things work. Everyone's looking at this chart of the Medicare supplements. What we did is we took the government chart and recreated it to make it a little bit easier to understand, and we added some color to it. So if you see yellow in a block, that means they don't cover what's over here on the left. Okay, and we footnoted it down here. If there's a check in the block, that means they cover what's on the left 100%. Otherwise, you'll see a percentage like over in these blocks. There are 3 plans in dark blue, G, N, and F. They are the 3 most popular plans that people buy. They are, most companies sell them. By the way, insurance companies can pick and choose which plans they want to sell. Not every company sells every plan. It's completely up to them what they sell. But almost every plan, insurance company covers, or at least has, those 3 plans to offer. So let's talk about Plan F, since I know there are some people that would like to do that. So Plan F is the best plan you can buy. Why? Well, you can see that everything here is checked. So that means between Medicare and the supplement, if you have inpatient or outpatient care, you're going to pay nothing. There is no deductible, there's no coinsurance, there's no copay. 0 out of pocket. That's what makes it the best plan you can buy. About 6 years ago, Medicare said, you know what? No one pays anything. We believe that utilization is too high because nobody pays anything. So we're going to discontinue this plan. But what they did is they said, we're not just going to stop it. We're going to cut it off. We're going to say anyone who turns 65 or is Medicare eligible, I should say that, Medicare eligible January of 2020, you cannot get Plan F. Anyone who's older, either is on Medicare due to disability or was 65 prior to January of 2020, they not only can have an F plan, but continue to have an F plan. You can buy it, you can switch if your health allows to an F plan even today. So in essence, what they're doing is they're saying, we'll let you have it, and we're going to basically have the F plan die out as the older people die out. It'll just die with them. That's what they're doing. So let's go over why people are not buying F any longer, even the ones that are eligible. If you look at Plan G, Plan G is identical in every way to Plan F, except for one feature. By the way, the scope of what these plans cover are identical. It doesn't matter which plan you buy. It doesn't mean that one plan is going to cover MRIs and the other one is not. They're all identical that way. It's a matter of what you're spending out of pocket when you receive services. But Plan G covers you 100% in the hospital, just like F. But with Plan G, Plan G does not pay the 2021 deductible. I know Roseanne said 198 for last year. It's 203 this year. It went up $5. So if you have Plan G, you pay the first $203 of outpatient expense per calendar year, and then you pay nothing after that. Okay. So now, why does someone buy Plan G instead of Plan F? The main reason is that Plan F costs more than $203 more than Plan G. So why would you spend more in premium than you're going to get in coverage? I've had people say, well, you know, that deductible can go up. Well, if it does, I guarantee you the company who you have Plan F with will raise the premium to cover it. There's no win here. Secondly is, a couple of years back, when this first started, the difference in cost between F and G with some companies was $300 to $700 a year more for Plan F. You're not going to pay $300 to $700 more to cover a $203 deductible. That just doesn't make sense. Pretty sure our financial planner would agree with me. So that's the reason. Now, in more recent years, like in the last year or so, a lot of companies brought down the cost of F. I believe that's temporary. The reason they're doing that is they want to get more people into Plan F that can qualify medically so that the costs don't really skyrocket, but that's not what's being sold. So while they may be a little bit lower temporarily, I think you're going to see them go back up again because most of the people that have Plan F are either older or too sick to be able to switch. So it's not a good risk pool. So if it were me, I'd stay clear of it. If you have an opportunity to switch, you switch.
Okay.
Peg, I hope I just answered your question on that. Secondly, there's another good plan choice, which is Plan N. So Plan N also covers you 100% in the hospital like F or G. So none of them or all of them are the same when it comes to inpatient hospital care. With Plan N, you're going to pay the $203 deductible like you do with G, but once that deductible is met, you pay a $20 copay. It's technically 20% up to $20, but I think it's pretty rare to see a doctor for less than $100. So it's a $20 copay for any type of doctor. It's actually primary, specialist, or even any, that also applies to lab work, MRIs, anything outpatient. It's anything outpatient, it's a $20 copay. And if you go to an ER or urgent care, it's a $50 copay. Now, for most people, that's a pretty good plan. I can tell you when I look at the numbers, for most people, it's somewhere between 20 and 25 visits a year, outpatient visits that you have to incur before Plan N becomes more expensive than Plan G. So you have to gauge that a little bit, but we do a lot of business with Plan N. We like it a lot. The only downside to Plan N is if you look, there's a second yellow block, and when you read across, it says Part B excess charges. So first of all, what is that? There are two types of Medicare doctors. Again, first of all, it only refers to outpatient. So let's just use a doctor. Again, it can be anything outpatient, but let's use a doctor's office. If a doctor's office accepts Medicare, so they're accepting Medicare like an insurance plan in the practice, and they accept assignment, so they're getting paid directly from Medicare, you're not getting the money and then sending it to your doctor. The money's going directly to the doctor's office. If both those things exist, then that provider must accept what Medicare says is the allowable charge. If that same doctor's office accepts Medicare, but does not accept assignment, most states allow that doctor to bill you 15% above what Medicare allows. So two things about that. Number one, footnote number two, these states do not allow excess billing. Pennsylvania's on there. So if you live in Pennsylvania, you're buying a plan in Pennsylvania, you're, well, let me backtrack for a minute. It's not where you buy the plan, it's where you have the service provided. But most people are getting most of their services that live here. But if you live in Pennsylvania, but you happen to be in Florida and you get services, you could potentially be balance billed. Again, because it's where the service is being provided. That being said,
Steve, I think that term you used twice and it broke up a little bit. What's that called?
Part B excess charges.
Yeah, I thought there was something else you said. That's okay. Go ahead.
So what I said was that, was it the last thing I said that broke up?
Yeah, I think so. Could something build? What are you calling it?
So I said, if you're in a state that allows the excess billing,
Mhm.
excess charge, excess billing, if that, it's only the providers that do not accept assignment that can excess bill you.
Okay, I got that.
All right. Now,
Okay.
the statistics are, even in the states, and by the way, you can see there's only a handful of states that don't allow excess billing. So
Mhm.
most states do. The statistics are that better than 90% of all the Medicare providers accept assignment. I used to say 90%. It's something you can Google. Last time I looked, it was 93%. So it means roughly about 7% of the Medicare outpatient world can excess bill you. So it's a small percentage, even in the states that allow it. If you have an F plan or a G plan, they will pay the excess charge if you happen to encounter it, where the N plan does not do that. So if you tend to travel a fair amount, I think the G plan's better. If you're not really traveling too much, I think most people could live with the N. Okay? So hopefully, Peg, I answered her question about Plan F. I think the reason that people aren't buying F is you're overpaying in premium for that privilege. All right. At the very bottom here is a link that you can use to find out if a provider accepts Medicare. That's one way to do it. The other way is you call the provider and ask them. And again, Medicare is the largest network in this country. One of the reasons it's so robust is Medicare pays better to the providers than the Advantage plans do, than this stuff does. So it's better accepted because this is a better payer. We happen to do a hospital system. We do the retirees for a local hospital system. We have a lot of retiring physicians. What I just told you came from them. So they much prefer original Medicare. It's a better payer.
Interesting.
Okay. All right. Any questions about this?
Yeah, we got two questions there. Well, one was a comment. So Anne wrote, any insurance carriers sell policies to cover you abroad for a short period of time, for example, 2-week vacation in Mexico.
That's true. You can buy travel insurance.
Yeah.
Right.
Roseanne asks, can Steve give a specific example of Part B excess billing for an amount above what Medicare assigns? For example, if Maryland charges $100 and Medicare pays the doctor $25, does it mean the patient pays 15% of 75?
It's 15% above the Medicare allowable charge.
Okay.
And the allowable charge varies. The regional. It's not a national charge. It varies by region. So I don't know what the actual what Medicare allowable charge would be in Maryland, for example. I don't even know what it is in Pennsylvania. But I know that it's 15% above what they allow is what the doctor is allowed to bill. Does that answer? I hope.
I think so. And I think her example, without knowing if it's correct or not, is correct as well. So she gave the example of $100. Medicare allowable is the Medicare coverage is 25. If the allowable amount was 75, then the patient would be on the hook for 15% of 75.
Yes.
Yes. Okay.
Okay.
Mm-hmm.
All right. Any other questions?
Maybe one more. Let's see.
Okay.
Yep. Now, Roseanne was just clarifying. Here we have another one. Hold on one second. Gene asks, if you retire with a company's health plan and pension plan, do you still have to pay $148 a month for Medicare when you sign up for Social Security?
I believe that you probably will. If you're on a group retiree plan, you'll have to check, but I'll bet that they say that you have to be on Medicare A and B. Yeah, you would check with HR to confirm that.
Okay. Good answer. Okay, moving on.
Okay. So again, sort of in a nutshell, why do people buy supplements over Advantage plans? Bigger network, easier access, less out of pocket. That's what it's about. For a lot, and it doesn't mean that everybody does. We have, as Del Senior Advisors, we have both. But for well, let me give you some statistical information. Of all the Medicare recipients in this country, about 1/3 have these Advantage plans, which means 2/3 don't. So 2/3 of the Medicare population have a supplement and original Medicare. They've gained a lot. The advantage plans have gained a lot in popularity because everybody sees the zero premium and like that. There's a price to be paid later depending on how severe your health is. And that's what the concern would be. Okay?
Yes.
All right. Let's talk about Part D drug cards. So these are called Medicare Part D drug cards, but you are not buying it from Medicare. You're still buying it from a private insurer. But Medicare sets the minimum standard that all the insurance companies have to adhere to if they want to sell a drug card. The way it works is most plans have a deductible. All have something called cost sharing. All have something called the coverage gap or donut hole, and all have something called catastrophic. They all have this, okay? You can't get away from it. You're moving, I'm going to call them phases. You're moving from one phase to the next based on the drugs you're taking. So you're moving, it's based on the accumulated retail drugs you're consuming. And as you hit these dollar amounts, you're moving to the next phase. The amount that you spend for a drug will vary, the same drug even, depending on what phase of the drug card you're in. That's how it works. Now, this again is the minimum standard. There are plenty of plans that are better than this. They just can't be any worse. When you're looking for a Part D drug plan, you're not deciding which is the right one based on whether it does or does not have a deductible. You're also not deciding which plan to pick based on the premium, whether it's cheap or high. Medicare drug plan premiums are as cheap as $7.30, as much as $180 a month. You're basing it on the overall cheapest cost. So the overall cheapest cost is a combination of the monthly premium times 12. And by the way, Medicare calculates this for you automatically if you know how to do it. We do it for our clients when they come in, and on an annual basis, you get an open enrollment email with a tutorial that I created on how to do this. I took screenshots of what you'll see on your computer and said, step 1, do this, step 2, do this. In 10 minutes, you can figure this out. So, and last year, what we did is we did a Zoom webinar where we did a live presentation on how to do this. We recorded it and we sent it out to everybody. So we also do that, and we'll do it again this year.
Great.
But again, you're looking for the plan with the lowest overall cost, which is a combination of what you pay for your drugs when you pick them up for the year. Medicare automatically factors in the deductible into that if there is one, and plus the premium that you're going to pay for the year. You want to add all three of those together and you come up with the lowest cost. That's how it's done. There is no other way to do it. Well, there are other ways to do it, but they wouldn't be correct. And you need to look at a new drug card each and every year. Why? Well, your drugs might change. Mm-hmm. There's a better option. Now that you change your drugs, there might be a better option that's going to cost you less money. Your drugs didn't change. The plan didn't change. The premium's the same, but they may have changed the formulary. So now, all of a sudden, that drug that was $10 is now $35, or it could be considerably more. Plans come in, plans go out. There are a lot of changes from the year to year. In the current year, we have 33 plans to choose from. The choices are always the same. It's just the order that the plans come up varies depending on the drugs you're taking. So we encourage people to look at a drug plan each and every year. That is the only way to know that you have the best overall cost. And it's easy to do because when you go through the exercise, as I teach people to do it, I'm teaching how to enroll on the Medicare site. If you enroll in a new drug plan, Medicare will take you out of the old one automatically. You don't even have to cancel the old one. They don't want to hear from you. So it's easy. If it turns out that the same plan that you had is the right one for the next year, you don't have to do anything. It'll automatically renew. So it's relatively easy. If you don't take any drugs, you still need to buy a drug plan. And the reason for that is Medicare will charge you a penalty for every month you go without a drug plan. It is 1% of the national average drug plan, which in 2021 is $30, and I have it down here, it's $30.50 per month. That's the national average. They're roughly charging you 30 cents per month for every month you go without. So if you went a year, that's roughly $3.60, but that penalty is a monthly penalty. You go 2 years at $7.20 and so forth. You won't pay that penalty until someday if you decide to come back into the system, but you will pay that penalty for the rest of your life on top of anything else. And the reason behind that is you need the good, the bad, and the ugly. If we just have the bad and the ugly, it costs us all more money. We need to spread the risk out through everyone. That's how insurance works. So that's why there's a penalty. So there are drug plans as cheap as $7.30. I think I mentioned that a little bit earlier. And if you don't take any drugs, that's what you go with, the super cheap drug plan. And it doesn't mean you won't take drugs forever. Very few cases does that happen. But it is important to have a drug plan and do it correctly so that you have the best value for your dollar. That's all I have for this evening. Are there any additional questions, Mark?
No, that was really great timing, though. I don't see any additional questions at all. I think there were some really great questions along the way. I'm just trying to get myself situated here. Really great questions along the way. Michael raised his hand. All right, so there's two. So Roseanne asked, thank God for Roseanne and Peg. Boy, it's really great. The Roseannes and Peg. If you are a veteran, do you still go on Medicare?
Yes, but so the VA does offer some drug plans. And for some people it works, but it's limited on the drugs you can get. So there is an exception to the Part D that if you're a veteran, you can use the VA for drugs and not pay a penalty if you want to get a Part D drug card later. I've had numerous vets start out that way and found that they couldn't get everything they needed and then they changed.
So is that any veteran, or do you have to classify in certain, during times of engagement?
I don't know enough about it to know, but if they're eligible for VA benefits, then they can get drugs.
I see. Peg just said, thank you, Steve. And I'm glad Peg, so Peg was the one, I think you said she goes by Peg, who sent the question in ahead of time with another Peg. So
he did.
Yeah, so that's
I know her too.
Yep. She asked also, does it pay to get vision and dental?
We're going to separate those.
Okay.
First of all, many of the Medicare supplement plans that we offer have some discount vision and hearing built in. It's built in, it's free, so that's worth it because it's a discount plan. What I find with vision plans is the premium is almost half of what the benefit is. So I'm not a big fan of buying vision plans. Now, when it comes to dental, that's different. I think dental is a good deal for two reasons. Number one, with most dental plans, you're going to get 2 cleanings a year paid at 100%. And a cleaning is easily $125 per cleaning, so that's $250 or $20 a month. So you're spending $20 a month just for 2 cleanings with no dental insurance. So for another $20 or $30 more, you could have 80% of any basic work covered, 50% of any major work covered. And then maybe even more importantly is when you have a dental plan and you're using it correctly, and what I mean by that is you're going to an in-network provider, you are getting the benefit of the discounts that you would not have without dental insurance. So your cost should be down because you're getting the insurance company's discounts with that provider. So for those reasons, I think dental makes sense.
Okay.
That answer the question, I hope?
Yeah, it sounds good. I personally, I know you're talking about Medicare and I'm not on Medicare yet, but I struggle with that every year with dental and vision. My medical program that I get through Steve covers some level of vision. I've toggled back and forth with dental because of course I go to an out of network dentist as I do an out of network doctor. It's crazy, but I don't play by those rules apparently. So Michael asks, hello again, Michael, any chance of getting a copy of this presentation? And yes, Steve had said, if you email Steve, and Steve, why don't you give out your email?
So yeah, so my email is sbobrin, B-O-B, boy, oh boy, R-I-N, at Del Val, it's short for Delaware Valley. It's Del Val Seniors with an S, So it's sbobrin@delvalseniors.com. Actually, Mark, do you mind putting it in the chat?
If I can, yeah.
I think you can.
Well, I can't do chat because chat's disabled, but I'll tell you what, this is what I'm going to do. I'll send an email either tomorrow or Friday with Steve's contact information to everyone who's been on this call.
I'm happy to send it out if anybody wants it. So one of the things, so tonight is a purely educational event. So we don't talk about specific plans and rates, and I'm not allowed to do that in an educational environment. When we do one-on-ones with people, we used to do them in person, but since the pandemic, we Zoom. That's how we do it, just like you're doing tonight. But those are one-on-ones where we make specific plan recommendations and costs so that you see, this is part of a larger presentation that we put together for an individual. It's all free. We get paid directly from the insurer. It does not affect the cost that you pay. You're paying for me whether you use me or not. It's just built into the premium. And so everything we do, it's no cost to you, and we're happy to do one-on-ones with anyone who wants it.
That's a great point. I was actually going to ask you to describe how you get paid. So that's really great. And I'm sorry, I was looking for a way to quickly just put your email up there. I apologize to everybody. I should have thought about that, but I wrote myself a note. I'll get as I said, I'll get an email out to everybody with Steve's contact info. Roseanne said, great webinar. Thanks to both of you for your time and expertise. Thank you, Roseanne.
Thanks for the compliment.
Jean says or asks, does Social Security deduct the Medicare premium from your Social Security check?
They do once you start collecting. Prior to that, they bill you.
Yeah. Okay. So they do once you start collecting Social Security. So if you wait until if you go on Medicare, just if I can clarify, just to make sure I'm understanding you right. If you start Medicare at age 65, most people don't start collecting Social Security until their full retirement age, which is 66 and 3 months, or 67 years old, or 66. Some people wait until they're 70 to collect Social Security. And that all depends on your needs. And there's no single right answer for that. So be careful about that. So what Steve just said is, if you're on Social Security, then they're going to bill you automatically.
They're going to deduct it from your check automatically.
I'm sorry, that's what I meant. They're going to deduct it. If you're not on Social Security, they're going to bill you. So
the only way they bill is quarterly. When you get your first bill, there's something called, they have two, what they call easy pay options. The first is you can set it up as a monthly auto draft from your checking account. They will do that. The second way is you can have it deducted each month from your credit card, no surcharge, but you get miles if you're looking for that. So that's my personal favorite. So you can do that. If you want to bill, it's only done one way, it's quarterly. And then again, as Mark said, once you start collecting, that all goes off the table. It just comes right out of your Social Security check.
Okay. Al asks, make sure that's the next one. Al asks, if I have insurance through my school, what Medicare plan do I need for the 20%?
Is Al full-time or part-time?
I don't know.
So it depends. So if you're working for a school district, which is obviously more than 20 employees, you can be over 65 and just be on your group health plan and not have Medicare. You can do that.
Okay. This might add to that. And Al also asks, how much prior time is needed if I am 67 plus old to sign up?
So I think you should start the process of, like, let's say, talking to us about 4 or 5 months prior to the date that you need it, because we'll help you get your ducks in a row. And then you want to start the process with Medicare approximately 60 days prior to the date that you need it.
Yeah, good answer. Gene asks, my vision cost is expensive for glasses, contacts, annual glaucoma exam. What is the cost of Medicare vision premium?
There is no vision premium for Medicare. There's no vision coverage. There's no specific vision plan. Like, they won't pay for routine glasses. They do pay for things like glaucoma screenings and things of that sort, but that's covered under medical. But there is not a vision plan under Medicare. Now, some Advantage plans may have some vision coverage built into them, but original Medicare doesn't pay for routine vision things.
Okay. What would be the best way if someone was on Medicare to add a vision plan to his or her plan or coverage?
There are some plans that offer dental, vision, and hearing combinations that I've seen out there. That's probably the best thing that I can think of. Honestly, I don't think there's a great option for vision.
Okay.
Is my honest answer.
That's what we want. Michael said, thank you. Thank you, Michael. Peg listed your email address. So here's what I'm going to do. So everybody
Great. Thank you.
I'm going to list this. Oh, no, I did answer live. I think everyone should see that now and answered. You should be able to see Steve's email address. Kathy, hi, Kathy. Kathy writes, any suggestions on where or how to do a dental insurance coverage search?
The easiest way is to come to us.
Yeah. Yeah.
We have some fairly unique plans.
Kathy, I can't, as I said before, I can't recommend Steve highly enough. I think you'll really appreciate Steve's detail and his depth of knowledge about this. Again, 100% recommend Steve. Al says, back to the question about the school. Al is a full-time teacher.
So there's two, when you're a full-time teacher, you can stay on the group health plan unless they have some provision that doesn't allow you to do that, but generally you can. When you retire as a full-time teacher, you are eligible for something called HOP, Health Options Plan is what they call it, through PSERS. So it generally is an okay option for the teacher. It's not always a great option for the spouse because you get a $100 monthly stipend that's included with most school districts, which makes it a little more attractive.
Yeah, that's assuming that he's a Pennsylvania, public school teacher or is in the PSERS program.
Correct. You're correct.
Yeah. Steve says, many thanks. You're welcome. Roseanne says, thanks guys. You are the best, with 4 or 5 exclamation points. Thank you, Roseanne. And
thank you.
Yeah. The other Roseanne asked, did you say you posted Steve's email address in the Q&A? Someone did, Peg did, and then I shared it in the answered, which should be available to everybody, but don't worry. Here's what's going to happen. I'm going to send an email either tomorrow or Friday, so before the weekend, with Steve Bobrin's contact information. If you need it immediately, send me an email, as many of you have already, to just reply to the email that you received about this webinar, and I'll make sure that I copy and paste Steve's contact information right in that, and I'll get it to you as soon as possible. I do work during the day, right? So I have a lot of appointments tomorrow, so I'll do it as soon as I can. But
or Mark, if it's easier for you, forward them to me, and then I'll send them out.
I may do that.
Okay, you're welcome to do that.
I may do that. And you can see on the screen, you have Steve's contact information, the old-fashioned way of phone call, right? 484-736-4677.
That is the number, but 484 seniors is a way to remember it.
484 seniors. You need a jingle.
I'll work on that.
Peg also thanks you. Much appreciate both your help and time. You're welcome. Thank you for your comment. Don says, I have Plan G and no dental plan. When can I enroll in a dental plan if I want to add one?
Any month you'd like. And we have some plans that don't have any waiting periods, which is unique in the individual dental plan market. So you'd be covered right away.
That's great. And Don, I think I've given you Steve's contact information before, and you may have talked to Steve before. So again, if you want that, send me an email and I'll send it to you. Roseanne says, in New Jersey, teachers must enroll in Medicare when they are eligible. Thank you. That would be public school teachers.
Mm-hmm.
So Jean asks a clarifying question. Please clarify, if I don't sign up for Social Security until age 65, but I will be billed from Medicare starting at age 60. Excuse me, I misread that. Please clarify, if I don't sign up for Social Security until age 67, but I will be billed for Medicare starting at age 65. That's unfair, Jean says, with a exclamation point.
Well, they're not, they have nothing. Okay, so let's clarify how this happens. years ago, people all signed up for Medicare at 65. That's everybody signed up for years ago. Everybody signed up for Social Security at 65 and Medicare at 65. They used to be the same. A number of years back, that all changed. Medicare is still 65, but Social Security for getting your full benefit, as Mark mentioned, could be 66, 67. So they're not on the same timetable any longer. So if you have to sign up for Medicare at 65, that's because of your work situation that creates that situation. But the Social Security situation is a completely different system.
Yeah,
Does that
so
help?
it still has to be paid for that premium. It's just not being directly billed from your Social Security. Once you start collecting
Correct.
Social Security,
Yeah, you're going to pay
government-
it either way.
it's just the government's just going to suck that out and take it
Right.
like that.
That's correct.
Kathy agreed with me. Thank you for your information and session. Thank you for an excellent webinar, Gene says. And Peg says, thanks, learning more every day. All right, folks, that was really great. Steve, I want to thank you again.
Thank you all for your time tonight.
Yeah, and this is just so informative. I really appreciate the time that Steve took. I appreciate all of you being here and your really great questions. You'll see me next Tuesday at 10 a.m. at my regular Tuesday morning webinar. My next special Wednesday evening webinar, not yet scheduled, will be the best realtor in the Pennsylvania, New Jersey area. That's my older brother, Jim, who's been in the business now 35 years. And we're still trying to track down our great mortgage person, Chris Harding. We're going to talk about this crazy hot real estate market and what's going on with it, because there's so many of you who are entering into retirement. And one of the things that you often talk about with me is, I want to downsize. What does that look like? Where do I go? Many of you folks who live in New Jersey say, I want to move out of New Jersey. My taxes are too darn high. I want to go to Pennsylvania, Delaware, Florida, wherever that's going to be. So it's a timely discussion why this market is crazy hot. So my brother's been doing this for 35 years, and he says he's never, ever seen it like this. He'll list a house on a Friday and he'll have 7 to 10 offers by the end of the weekend. So that's really wonderful. But we'll see what's going on out there. So we'll see you Tuesday. Give us a call or follow up. You have an opportunity to schedule time with me. I know my calendar is full, so it may be a week or two before you can get in. If you can't find a time that works for you, reach out to the office. Either respond to the email that you received from us or call us the old-fashioned way, 215-310-9440. I don't have any catchy, tagline to go with it. I'm a little jealous, and we'll make time for you. We'll be sure to get in what works for you. So that's it, folks. Really appreciate it. Thanks, Steve. I'm sure we'll talk soon.
So yes, thank you, Mark. First of all, thanks for having me. Thank you all for listening to me tonight. And Mark, I guess since I told everyone Mark's my financial planner, I'll see you next week on Zoom for that.
Right. All right. See you, everyone. Have a great
Bye-bye.
Bye-bye. Hello again. I hope you enjoyed the video and perhaps you learned something new that can help you. If you want to schedule time for me for a no cost, no obligation consultation, you can use the link in the description and schedule a time that works best for you. If my schedule is full and you can't find anything, don't worry. Send us an email and we'll find a time that works for you. I look forward to speaking with you soon. Thank you. Have a great day.